2014 when we introduced AdaptDx, we identified so many more patients that actually had the defining marker of AMD, and our outcomes over a 5.5-year period of time have been tremendous in patients being able to keep their vision. We know in our office we still had many patients kind of falling through the cracks and not coming back for testing. So our current setup in our office, we do have a diagnostic room that's dedicated to our AdaptDx, but also our OCT and our visual field and our Quantify testing. We have a 3-month backlog just on patients waiting to have that test because of physical limitations. So the AdaptDx Pro just takes that barrier away. Those patients desiring testing that day will be able to have it. I'm so excited about the AdaptDx Pro. It's what I've been waiting for. I anticipate delivering 3 to 4 times the number of tests per month. And just statistically, out of those tests that are delivered, we're going to find patients that have AMD. This past year, we collected our numbers in regard to the number of AMD patients that we identified. And out of that number, there was a significant percentage that had we not had the AdaptDx, then to identify them, would have been untreated because they had no macular findings and no vision loss. And so out of 300 patients, we would have had 116 that would have been unidentified, and that just is not acceptable in my mind. Our goal as optometrists is to preserve vision and to provide vision for a lifetime for patients. And so the thought of missing a disease that is the leading cause of blindness really weighed heavy on my heart. And so to be able to identify those patients and treat them, whether they're your postman, your parishioner, your neighbor, a relative, it's just a tremendous feeling to be able to do that. The AdaptDx Pro is going to be a game changer when it comes to the future of AMD care, just in identification, being able to identify more patients with subclinical AMD, those patients that you would have never referred to a retinal specialist for consultation, those patients that you would have never had that discussion about to stop smoking, to go ahead and start nutraceuticals, to have a consultation with a family doctor about blood sugar, blood pressure, and cholesterol. All of those results from a positive RI and AMD diagnosis using the AdaptDx Pro. And it's just going to skyrocket those numbers and essentially affect millions of patients around the globe. I can't unknow what I know, and I would consider it, in my case, unethical to practice without the AdaptDx because I know I would be missing patients with a potential blinding condition.